The topic of this video is the skeletal system, and specifically the skull of the skeletal system. Alright, so we're going to start with a couple of different views. We're going to be looking at the outside of the skull, and let's first start by drawing out two different views of our skull. So just draw along with me. And these never have to be perfect. Mine are never going to be perfect. I'm just going to try to make them as good as I can. Alright, so that is the frontal view of the skull. And essentially this is where we talk about views in terms of where we're standing when we're looking at someone. So we're also going to draw a lateral view of the skull down below. Alrighty, so let's just add in an eye socket here, and we're almost done. Alrighty, so now we got the outline for our skull. Sorry, I didn't, left that out of the picture a little bit. Okay, so we're going to identify a series of different bones, and they are, for most of them, you'll be able to see them on both views of the skull, but some you may only be able to see in this lateral view. And so I'm always gonna, whenever I remember, label right and left. Doesn't really matter here because it's the same on both sides, but just so you know what view, this is gonna be anterior and posterior. Alright, so let's start with our nasal bone. You guessed it, it's right around where the nose is. It's gonna be right there. And I'm just gonna color it in. It would help if my markers were better, but I'll get rid of this marker in a second. And we can see the nasal bone from the frontal view and also from the lateral view. Right here. Now, I'm just gonna write it off to the side. Remember, our color is always going to be associated with a different part of anatomy, and I'll write the name that that color is associated with to the side. So that's going to be our nasal bone. Okay. Now let's draw our frontal bone. And so all of these are different parts of the skull. So this big piece where the forehead is basically is our frontal bone. And it's easiest to see on this frontal view. So again, as always, I encourage you to color along with me. It's really just going to help so much visually. That's how I learned anatomy the best, and it has worked great for students in the past. And I'm trying my best to make things as proportionate as possible. So I know you'll do the same, but that's why I also encourage you to keep a textbook around to really make sure that you're getting the idea, even if things aren't exactly proportional. So again, that's our frontal bone. Now let's draw in our maxilla. The maxilla is going to be all of this, basically around the nose area and on the upper part of the mouth. And again, just like most of these, you'll be able to see it in both this frontal view and the lateral view. That's our maxilla. Now, people will often get the maxilla mixed up with this next bone, so just make sure that you're paying attention to differentiating between these. The next bone is our mandible. I think it's because they both start with an M. I think that's why people usually get them confused, but your mandible is like your jawbone. So that's how I kind of remember. I also know that the maxilla is above the lip, so for some reason, I kind of picture, ever since I learned anatomy years and years ago, I kind of pictured a guy named Max with a mustache, and that's how I remember that it's maxilla, but up near where the mustache is. But use whatever method that works for you, as long as you know it. One for this class, and then later, since a lot of you will end up in clinical situations, you want to make sure you know your bones if you end up dealing with a real patient. So those are our mandibles. Now let's draw in a bone called our zygomatic bone. It's kind of a fun word to say. Again, just like all of this, we're going to have it on both sides. So it's always going to be symmetrical here for the most part. You know, there are always anatomical differences where sometimes people don't have quite as much like exact symmetry. But, you know, for the most part, it's going to be almost exactly the same. And our zygomatic bone here is going to be seen right there in the lateral view. And we're unintentionally creating a nice little rainbow skull for ourselves. All right, next let's do our temporal bone, which is right where we kind of the area that we call our temples. That's right where our temporal bone is. See, anatomy isn't that hard. It makes sense, right? So that dark green is our temporal bone, and we can also see it down here. So that wraps up our temporal bone. Now, just one left that we'll be able to see on both, and that is our sphenoid bone. Now, the sphenoid bone is kind of odd, and you can actually see it a little bit more inside of the skull, so we'll also take a look at that like inside view. But you can see it a little bit on the outside as well. So I'm going to draw it in right here in pink. I wish those colors were a little bit different. I'm gonna draw a little line because I unintentionally, just with a pencil, I unintentionally use colors that are kind of similar right there. So I want to just make sure that you can see that line in this video. So there's a clean break between zygomatic and sphenoid. And then same thing here. Just draw a little line in. Sorry about that. I didn't realize they were going to be that similar. Our sphenoid bone is going to be right here. Sphenoid is also a funny word. And then kind of coming through right there. So that's sphenoid. Alrighty, now we have two more skull bones that we're only going to be able to see in the lateral view. So our first is our parietal bone, which is going to be this whole big area right here. That is our parietal. And the last bone we have is the occipital. Right down here. Now, as you're learning the names of these bones, keep in mind that we're also going to be learning the different lobes of the brain, and they're associated with different names of the bones here. So the better you know this, the better our neurology section is going to be. So just a quick recap. This is our frontal view, this is our lateral view, and we just went over our nasal, frontal, maxilla, remember that's like right above the lip, mandible, which is the jaw, zygomatic, which is on the side there, temporal, which is usually where people say their temples are, where they have a headache. That bone is actually really thin, and I used to work for another faculty member at Coastline, Dr. Henry, and she's used to be a neurosurgeon, and she has talked about how thin the temporal bone is before, and talking about like emergency surgery where she'd actually have to just break through that bone super quickly to be able to get to the brain. So make note of how thin that is when you're looking at the models. We have our sphenoid bone, which remember we can't really see much of on the outside here. We can see a little more on the inside when we take a closer look at it later. And then we have our parietal and occipital bone. Okay, so this covers overall the outside of the bone of the skull. Now let's take a closer look at part of the inside. Alrighty, now we're going to look at the inside of the skull. So I'm just gonna say skull inside. So here, this is going to be a superior view, which is looking from the top down into the inside of the skull. So let me draw this out. I'm going to do my very best to make it as good as I can for you. And you'll be able to kind of compare this to what's in your textbook and what is in models. So your skull's kind of oval shaped. And I'm going to first draw in a couple of different parts of the skull, in addition to a few different things that we call foramen, which are holes. So just hang in there with me as I draw some things out, okay? And draw along with me, please. So remember, like we said, everything is going to be symmetrical. So if there's a hole on one side, there's going to be a hole on the other side. Alrighty, so all of these holes are currently meaningless, but let's add some meaning in. First of all, I'm just going to write an A here for anterior and a P here for posterior. So let's get started. A few things that I want to, oops, I forgot one little part. Hang in there with me. I'm sorry, I know this is taking a little bit of time. Okay. So let's first label some parts of the skull itself, and then I'm going to talk about all these little dots everywhere, which are called foramen, which are basically holes. For most of those holes, you're actually going to have cranial nerves moving or traveling through them. So cranial nerves are nerves that have to do with your brain, and we'll get into the function of those as we get into our neurology section, so just kind of stay tuned for that. But in terms of these foramen, we will review the cranial nerves and sometimes other structures that pass through them, okay? But first, let's talk about the different sections here in the skull. So we will start out with 3 different fossas. See, how do I want to do this? All right, let's do we're gonna do some markers here. Basically from here, all of this, I'm just gonna do this on one side of the skull, even though remember everything is bilateral, so equal on both sides. But where this turquoise little marker is, that is our anterior fossa. Because remember, we're a superior view looking down on the inside of the skull, and this is the front, this is the back, so this is anterior and this is posterior. So this right here is our anterior fossa. Alrighty. Next we have our middle fossa right here. Remember, there's one on both sides. And then if this is the anterior fossa right here, what do you think this is going to be? If you guess posterior fossa, you're right. It's also sometimes called the occipital fossa, because that is where our occipital bone is. And we just learned that. We're looking at the outside of the skull. So that is our posterior or occipital fossa. Alrighty, let's see. We're gonna label a few more things. You have a little piece of bone right here that sticks up right in the middle there. That is going to be called crista galli. And that actually means the crest of the rooster in Latin, which, you know, anatomy is basically all Latin. So anyway, just in case, basically that sticks up in the air and it comes out towards us. So it comes out superiorly. So it kind of looks like the top of a rooster, if you picture that in your brain. Yeah. So let's see, I think, oh, one more thing that I want us to draw out, and that is our petrous ridge, which is this structure here. I'm just gonna color it in for us. And you'll be able to see that on the skull in the model, but it's just this little ridge. And I think that's it. All right, so those are the main structures that I want you to know in terms of this view of the skull. Now, what I want you to do is we're going to switch gears and go into the different foramen, or the different holes in the skull. Alrighty, so our first one is going to be our cribriform plate, which is actually part of the ethmoid bone, but our cribriform plate is right here. And basically that structure, the crista galli, sticks out up from it. So again, I chose two colors that are pretty similar, so I'm just going to draw a little outline here so you can see distinctly where the border of the cribriform plate is and where the crista galli sticks out. Now I'm going to add in a couple little black dots here to remember this, and let me explain that in just a second. So first, let's label that. It is our cribriform plate. Now, I drew those little black dots because, remember, we're talking about foramen here, meaning holes that nerves travel through. And remember I mentioned that most of the things that travel through these holes are cranial nerves. Now, what I'm going to do for all of these things that we're going to label is I'm going to put in parentheses to the side the Roman numeral of the cranial nerve that passes through that foramen, or that structure. So for the cribriform plate, cranial nerve 1 will pass through the cribriform plate, actually through where those black holes are. So just make note of that, and I'll do that for every other different foramen that we have. So I'll just put a little bullet there to organize ourselves. What's interesting about this cranial nerve is, you know, most of these cranial nerves will travel through as one big, almost like cylindrical type structure, like an actual nerve. This is broken up into teeny tiny little nerves passing through these little holes that are represented by the black dots. And what's interesting is that's cranial nerve number 1 passing through that, which is your olfactory nerve. You don't need to know this right now, but this is just like a side note that we'll learn later. But it's interesting because that is actually your nerve that controls smell. So during car accidents with like a really strong jolt, oftentimes, you know, you have these little teeny tiny nerves coming through all these holes. Oftentimes that nerve will get damaged, and so something that's pretty common after a car accident or a sudden like traumatic event like that is loss of smell, because those nerves are so vulnerable and tiny traveling through that small space compared to these really big holes down here with like nice thick nerves traveling through. So that's just a fun fact, nothing that you need to know right now other than, you know, what we're writing down. Alrighty, so now let's talk about let's see. let's go down our list from like here down. So our next one is going to be our superior orbital fissure. Right here. And fissure is kind of another name for a foramen, but a fissure is just longer and more narrow, and like a little bit jagged is basically what a fissure means. Now, through this superior orbital fissure, you actually have a bunch of different parts of cranial nerves traveling through it. You have cranial nerve 3, and just for future reference, we always identify cranial nerves with Roman numerals instead of like written numbers. So you have cranial nerve 3, cranial nerve 4, and the first branch of cranial nerve 5, as well as cranial nerve 6, all traveling through that, which makes sense, right? Because it's pretty wide and flat, so you have a bunch of stuff traveling through. Now, next to that, you also have your optic canal, which is right here. Those two little blue dots. And what makes sense is the name of the nerve often coincides with the foramen or the hole. So this is technically your optic canal, which is still a foramen. And what travels through there is your cranial nerve number 2, which is your optic nerve. So once we learn the names of these nerves, it will really help you remember which ones will pass through each foramen. All right, now we have foramen lacerum. Now for foramen lacerum, we'll color it in, but I don't need you to know what travels through it. There's kind of some like smaller structures, so just don't worry about that right now. But it's right here. Foramen lacerum, and it's actually named lacerum because it looks like a laceration because the sides are a little bit jagged. But again, we don't need to know the structures that pass through there because they're a little bit smaller and not as significant for us. Oops, and you know what? I just realized there's something right next to it that I forgot to label. So let me jump in here super fast and I'm going to label one extra thing. I'm going to use a dark green color and just color this in. This structure is not a foramen, but it's something that we call our sella turcica. So I'm going to write it up here because it's not a foramen. Sella turcica, which means Turkish saddle, which is it actually kind of like looks like a little saddle heel here, so it's easier to see in like 3D form, but if you can see it, it really is kind of like saddle shaped. So I forgot about that. But anyway, jumping back over to foramen, the next one I want to show you is your foramen rotundum. That is this little one right up here in brown. Foramen rotundum. And the cranial nerve that passes through there is the second branch of cranial nerve 5. So we're going to write 5, number 2. Remember, number 1 was up here through superior orbital fissure. The next one is foramen ovale. Foramen ovale is the larger foramen right here in the middle fossa. And that is going to have the third branch of cranial nerve 5. And then the last one in that middle fossa is our foramen spinosum. which are the little pink dots that I just colored in. Foramen spinosum. And the cranial, or actually, we don't have a cranial nerve that passes through there. We actually have the middle meningeal artery. Oops, I spelled that wrong. It should be M-E-N-I, meningeal artery. And whenever I write artery, I'm going to abbreviate it with AA. Same thing with vein. Vein will be VV, and muscle will be MM. So I think I already told you about the muscle one, and I'll remind you about the other ones next time we use them. All right, so one thing that people often get confused on is these foramen right here. So I came up with a little acronym type thing. It's not very complicated, but basically I'm separating these three structures that are kind of on their own in the middle fossa and giving them the abbreviation ROS for rotundum ovale spinosum. Because people often kind of try to throw in foramen lacerum and they kind of get these two confused when we're looking over them in lab. But for these structures that are just on their own on the outside in the middle fossa, remember, anteriorly to posteriorly, we're going to say ROS, rotundum ovale spinosum. And then lacerum is just kind of like on its own over here. All right. So let's keep going. We're going to move down to the foramen that is in the petrous ridge. So that is, let me find a color for that. That is our internal auditory meatus. It's going to be this light green color. Internal auditory meatus, and for that it's going to have two different things traveling through it. It will have cranial nerve 7 and cranial nerve 8. All right, we're almost done here. Hang in there with me. Our next one is going to be the jugular foramen. Those are the ones right here. I'll make them light blue. And there's quite a bit in here that travels through there. So we're going to have our internal jugular vein as well as our cranial nerve 9, 10, and 11. So 9, 10, and 11. I always have weird ways of remembering things, and my way for remembering this is that, you know how like in movies and in scary stuff, they're always talking about like, oh, they went right for the jugular to try to kill something, like if that's like a lion trying to kill its prey or whatever. So I think about that because the jugular has to be super important, right? Because it's a main vein there, and it's where predators will always attack. So I'm like, oh, you know what? This is something important. It has a bunch of things going through it, so it has to have a vein named after it. And then 9, 10, 11, for some reason, this is a little bit of a stretch, but when a lion kills its prey, when something is dead, they oftentimes put X's over it. So I remember that as the number 10. And then I remember, oops, we're going to have one before that and one after it. I know that sounds kind of crazy, but you know what? Sometimes you need crazy things to remember different parts of anatomy. And if that's how your brain works, all for it. If it doesn't, no worries. It's all good. I'm just throwing it out there in case it could possibly help you. Alrighty. 2 more to go. Let's do our hypoglossal foramen first. I'm going to make those dark blue up here. And once we learn the names of the cranial nerves, this will be even easier because the cranial nerve that travels through it is our hypoglossal nerve. So that is our cranial nerve number 12. And last but not least, we have a huge foramen, our foramen magnum right here. And that's actually where our spinal cord travels through. But we're just going to give it a name because there's no cranial nerve passing through it. That is our foramen magnum, where our spinal cord and like brainstem end up passing through. Okay, so now we finally have the inside view of the skull. We have all these structures to identify on it, and then we have all of these different foramen going through it with a bunch of different cranial nerves and a few other vascular structures. Now for the skull, we have a few more internal bones to cover. These are bones, some of which we saw in the other figures, but I just want to give you a different view to be able to see them a little bit easier. So I'm going to draw a little skull right here. This is just going to be an anterior view of a skull that's super simplified here. And then we're going to have these eye sockets like we did in some of the other ones. And then I'm also, so this is going to be anterior view. And this is the right and left. Then I'm also going to give you a lateral view. So this is a lateral view of a skull. Okay. This is anterior and oops. I wrote an R. I should have written a P for posterior. That's my mistake. Alrighty, so let's label some stuff. So we've got our ethmoid bone. Remember, our ethmoid bone is where our cribriform plate is. So I just want to show you, this is going to be an internal view. So it's as if we're looking through the first layer a little bit deeper into the skull and looking at the internal bones. So we have the ethmoid bone right here. And then a little bit more medially, we have the lacrimal or tear. That's what it means. So it's like right where those like the medial portion of your eyes are. That's where your lacrimal bone is. Now for this lateral view, there's a bunch more things we can see. So we have the sphenoid bone. So remember, we're looking at the internal part of the skull, so at the inside. So you're going to have the sphenoid bone. It's going to look sort of like this on the inside. This is very simplified. But when you look up a picture of the sphenoid bone in the model or in the book, it's going to look pretty complex, and you'll see how this is simplified. So that's our sphenoid bone. And then that's what is on top of that is our sella turcica. Remember, we drew that in the other view of the skull as well, which means Turkish saddle. And then actually what I want to point out is you have something that sits in the sella turcica, and that is actually your pituitary gland. So that sits right there. And that's going to be important for us to note the location of the pituitary gland and actually our optic nerves. Remember, if you look back on your skull drawing before, I'm going to pull it back in. Here is our sella turcica in this dark green here, and we have our optic nerves that come in through right here through the optic canal. And what happens is your nerves pass through where this sella turcica is, this turcic saddle, but your pituitary gland is sitting right there. And the way that the optic nerves are oriented, what happens is if you get a pituitary tumor in this gland that's sitting right there, oftentimes people will lose their peripheral vision. So if anyone is losing their peripheral vision, oftentimes what they'll do is they'll do imaging of the brain to see if there's a tumor of that pituitary gland that could be contributing to that loss of peripheral vision. So anatomy is super cool and important in that way. Now let's review a few other structures. So we have our, let's see, we have our external auditory meatus. Remember, we had an internal auditory meatus before, but now this is the external one. So this is something, auditory meatus. This is something that we'll see more externally. So the sphenoid, sella turcica, and pituitary gland, those are all like deep inside, and then the external auditory meatus is external. Now, a few other structures you'll be able to see externally on this lateral view is also something called your mastoid process, which is right about here in this blue color. And process really just means anything that's like sticking out. So it's like this little chunk of bone that's sticking out on the skull. You're also going to have a styloid process, which is going to come down right about here. And then I remember that because styloid process kind of reminds me of stiletto. And that kind of looks like the heel of a stiletto shoe. Now, you have your mastoid process and your styloid process. Now, in between them, you're going to have something called your stylomastoid foramen. Right here. And it takes a piece of both of those words. And what's actually going to travel through that foramen is cranial nerve 7. So that's one that we can only see on the outside, so that's why I'm including it here instead of in that other picture where we drew it was like the inside view of the skull with all of those other foramen. So this is the only one that we left out. Now, one other little thing to add here is something called your inion, or your external occipital protuberance. That's like a little part of the skull that's sticking out right in the back there. All right, so we covered some internal bones, the ethmoid, lacrimal, the sphenoid that has the sella turcica with the pituitary gland sitting on it. And then we also covered some things that we can see externally in this lateral view, like the external auditory meatus, these two processes, the foramen, and then the inion. Now let's continue taking a look at internal bones, but I'm gonna just draw a little line here just to separate things so we can keep it clear in our brains. And you know how we have like these little eye sockets? Well, I'm going to give you an anterior view of these. They're eye sockets, but they're actually called orbits. So I'm going to give you a little view of them a little closer together than they usually are. So this is going to be an anterior view of orbits or eye sockets. Now within them, you're going to have a few different things. You're going to have different canals that you'll be able to see. So I'm just going to draw them out. The first one is the optic foramen, which is also sometimes called the optic canal, that we pointed out in that first picture. So I'm going to bring that back in a second after we review the other two. So in addition, we're also going to have the superior orbital fissure, which you'll be able to see inside of the orbits or the eye sockets. And lastly, the inferior orbital fissure. So just pointing a few structures out. In our last picture, here is our optic canal, and then we have superior orbital fissure right here. Those are things that we can see from the inside superior view of this skull. So essentially, it is like a transverse cut through someone, and that's how we're looking down inside the skull. And then we can also see those things. Here's our optic foramen and canal. Remember, this is us looking at the front of the skull in an anterior view. We can see through these eye sockets, we can see the optic foramen or canals, that superior orbital fissure, and we can also see the inferior orbital fissure as well. Now, let's finish up with just a few more bones. I'm going to show you so we looked at the inside of the eye sockets or the nose right there, or excuse me, the eyes. Now I'm going to show you the inside of the nose. So you know how we have that opening like right about here, and then we also have the opening in our original drawing here, right there, and right here. So I'm going to show you what it looks like inside the nose right there if we're looking through it. So inside our nose, let me draw a little figure. This is what it looks like. And we're going to have one structure in the middle, which is going to be called our vomer or inferior septum. You may have heard someone saying like, oh, I have a deviated septum, and that makes it harder for them to breathe. So that's what they're talking about here. And we're also going to have something called turbinates or conchas. So I'm going to draw those out for us as well. They're going to look like this. You can't actually see the superior turbinate when you're looking at the model, so just take note of that. But we're gonna draw three because there are three. So these are the turbinates, or also called concha. And something to note is that the turbinates, I'm just gonna write down what they mean. They're turbine means to warm. So these structures assist in warming contents of the nose. And there is a superior, middle, and inferior turbinate. So that's superior, middle, and inferior. Okay, so that's inside of the nose. And you know, I promised you before that we would take a closer look at the sphenoid bone, so let's do that. All right, so for our sphenoid bone, it means wedge-like. That's just what the sphenoid means. Now, I'm going to draw it pretty simplified, but you can take a closer look at it when you look at the figures and when you look at your book. All right, so we're going to be looking at an anterior view. And I'm going to draw this, again, this is very simplified. Alrighty, so here's our right and here's our left. You have greater wings that are kind of just like this. It's the better part of this area right here. Those are greater wings. We also have a lesser wing, but it's just not pictured here. So I'm just gonna have you learn just this, the greater wing. Then we're going to have something that we'll call lateral pterygoid processes. So we're going to have a right and a left. And remember, medial is more towards midline. Lateral is away from midline. So that's why these are lateral and these are medial. So right and left, lateral pterygoid process. And then since we have that lateral, what else do you think we're gonna have here? That's right, you guessed it. It starts more medially here, so it's gonna be our right, our right and left medial pterygoid process. So that's all I want you to know for now. Again, there is like a lesser wing up here and some other parts, but these are the main pieces I want you to know of the sphenoid. Now, one final thing I want to point out is the bottom of the skull. Which is the inferior view. I just want to point out one main structure that we can only see from the bottom. So I'm going to attempt to draw the skull out here. So we're looking at the whole skull, but the bottom side of it. So this right here is going to be our mandible. And then we're going to have foramen magnum. And then we're going to have two different things right there. So just for reference, you know, this isn't the first time we've looked at foramen magnum, but I just want to point it out as a point of reference. I also want to point out that this is anterior and this is posterior, because we're looking at the bottom view of that skull. So foramen magnum. And there's going to be two little pieces on the skull in the front there that I wanted to point out for you. And those are going to be your occipital condyles. So those are important because that's where your skull will, we call it articulate, but really that's where your skull will form a joint with the highest bone in your spine. So that's how your skull connects to your spine. So that's why that's important there. And that's the last piece that we are going to learn in terms of the skeletal system and our school.